cloud so that anyone who is not here at the meeting will be able to get the meeting by way of the Lake Balboa Neighborhood Council website. Again, today is Wednesday the 19th. The time is 7:02, and I now officially declare the meeting open and welcome those who have attended. Since 2017, for the first time in our country's history, a person was more likely to die from an accidental opioid overdose than from a major motor vehicle crash, according to the National Safety Council. The odds of dying accidentally from an opioid overdose have risen even more sharply. In 2020, there were more than 70,000 people that died from accidental opioid overdoses. In 2021, there's more than 75,000 people who died from accidental opioid overdoses, and the numbers keep climbing. So obviously the topic for our meeting tonight will be sounding the alarm on the opioid crisis. I'm going to display the agenda. If I can find it. Well, tonight's agenda will be sounding the alarm on the opioid crisis. And let's see, I'm trying to locate the agenda. Bear with me. We've been having some problems with, well, I've been having some problems with the sharing tonight. Well, needless to say, I'm just going to go right on. Addressing the addressing the opioid overdose crisis. Who can tell me what an opioid is? There's the agenda. Okay. Can anyone tell me what an opioid is as you understand it? Anyone at all? Okay. We go to full screen. Okay. The topic for today, again, learning about opioids. We are going to be discussing the opioid overdose crisis, prevention strategies, how to recognize an opioid overdose, how to respond to an opioid overdose, and what the state and local laws are regarding responding to opioids. Now, opioids are a class of powerful medications that are prescribed by a healthcare provider designed to treat pain. Designed to treat pain. That's what an opioid is. And while when they're used for legitimate medical purposes, including short-term, long-term pain, cough suppression, odor control, severe diarrhea, prescription opioids are also sometimes used inappropriately. Now, in addition to the prescribed opioids, there are also illegal opioid formulations. Although the formulations pose a risk to dependence or abuse, they do so at varying degrees, according to the DEA. DEA has listed all of the drugs according to various schedules, and with marijuana listed at at Schedule 1. But however they are listed, it's important to understand that prescription opioids can be very dangerous to administer. They do manage chronic pain, but they come with risk if they're not used appropriately. Now, According to a national poll that was conducted by the National Safety Council, they conducted a poll several years ago to poll adults as to what their knowledge of opioids had to do with. And what they found is that most Americans don't know that painkillers contain opioids, or that it even is a felony to share them. They're unconcerned about addiction, but most have reason to worry. Now, opioid users overestimate the benefits of opioid and underestimate the risk of addictions or even death. Now, most people don't know that medicines that they have currently in their medicine cabinets have opioids, and that if used inappropriately, you can become addicted to them and even die simply based on continued use. Recognizing which medicines are opioids is important in order to prevent overuse emergencies. And to the right of the screen, you'll see several generic names of opioids like fentanyl, hydrocodone, hydromorphine, methadone, morphine, oxycodone. These are names that we know of and we've heard, and we know that some of our medicines contain these opioids. One of the major issues that our country has faced in the past is going after various drug manufacturers who fail to alert the public that their medications may be addicting and habit forming. Purdue Pharma is the one that comes to mind. They were fined by the government to the tune of $6 billion, which they've agreed to pay. They manufacture a medication called oxycodone. I'm sure a lot of you have heard of oxycodone. The reason why they were fined $6 billion had to do with the fact that they did not put a warning label on that medicine to let the public know that overuse can lead to serious consequences up to and including death. But Purdue Pharma is not the only one that the government has gone after. They've gone after McKesson Foods, they've gone after Johnson & Johnson. And in these cases with these manufacturers of drugs, each of them has pled guilty and is now on the hook for paying huge fines to the federal government for mislabeling their medications and agreeing to pay the penalty and to educate the public as to the habit-forming risk that the public takes in terms of taking that medication. If anyone has any questions, don't hesitate to stop me as we do this. Again, the next slide shows you more examples as to what are opioids. They're both natural, synthetic, and semi-synthetic opioids, up to and including morphine, codeine, heroin, fentanyl, as you can see. To the right, you'll see those medications that are not opioids. So be sure to check the labels when you buy or use any medications, and be sure to go by the directions that are listed on the labels for these medications. The World Health Organization has saying that people who are using opioids are most likely to suffer overdose. And the reason for that is because you can take these medications containing these opioids and not know you've become addicted. All you know is that you feel better, because the bottom line to the question that I asked earlier as to what an opioid is, an opioid is a pain reliever. It contains information that affects cells in the brain, in the spinal column, in the gut, that tells you that you no longer feel pain. And when you take these medications to relieve pain, that's all you're concerned with. This is why more than 40% of the American public aren't aware of the dangers of habit forming that can be experienced by taking some of these opioids. And we're going to be talking about that and other things as well. But who's taking these opioids? Again, as you can see, opioids are commonly used for acute, transient, and short-term injuries. you've sprained your knee, you've hurt your knee, you've hurt your back, you go to your doctor, and your doctor prescribes you an opioid. He doesn't call it an opioid. He calls it oxycodone or Oxycontin, as the case may be. He describes it as a pain reliever, and that's what you go home and that's what you take. And you take this medication because it makes you feel good. But within 6 days, it can become habit forming, according to the CDC. So it's important to note that the use of opioids without a prescription is also considered an illegal use and may include street drugs, as you can see down at the bottom, like heroin, fentanyl, carfenol, which is a more dangerous form of fentanyl, all of which are significantly more potent than the prescription grade agents that are prescribed by your doctors. Now, the issue that I alluded to earlier with respect to some of these companies that have been fined by the federal government for not informing the public as to the dangers of their drugs, what they do, and picture this, the manufacturers, the drug manufacturers, make and distribute these drugs to wholesalers. The wholesalers then in turn distribute the drugs to dealers or pharmaceutical companies. The pharmaceutical companies who have sales representatives on the street, the sales representatives go and make calls on physicians all across the country, and they offer them incentives to write prescriptions for their particular product. Therein lies the problem. This is what the problem has been from the beginning. A lot of physicians are incentivized to write prescriptions for their pain relieving products. And the more they write, the more they make. And so this has become a vicious cycle in terms of the manufacturing process, to the distribution process, to the prescription writing process that is done by physicians all over the country. And this is why the opioid crisis is such that it has now been declared a national emergency nationwide. So opioid dependency is a serious issue that we should all be aware of. And we should also be aware that even if you allow someone to use your medication, that in of itself is a felony. I'm sure most of us didn't know that, and I wasn't aware of that as well, but it is a felony. So this is something that we should be aware of. We should also be aware of the fact that it's so serious that 130 people a day die of accidental opioid overdoses. And so we're going to talk about what these overdoses are, how they occur, and what you do to treat them, and what your actions should be in terms of making sure that your families are aware of what's going on with the opioids and take the proper steps to prevent an accidental overdose. So on this slide, you see that there are 3 ways of opioid deaths that have occurred. The first wave, as you see at the bottom left in the purple, are involving prescription opioid overdoses. And as you can see from the purple line, how it goes up almost horizontally to where it says heroin. Wave 2 is the increase in heroin deaths that have occurred. But wave 3 is the synthetic opioid overdose deaths. And this includes prescribed or illicitly manufactured opioids up to and including fentanyl. And this is where we are today. With the increase and the spike in the number of deaths caused by fentanyl, this has been a key issue with respect to declaring opioid overdoses a national emergency. From 1999 up to 2021, there's been more than or close to 950,000 Americans that have died from drug-related overdoses. In 2020, there was 70,000. In 2021, there were 75,000 accidental overdose deaths, and that number is increasing. And of these deaths, more than 80% of these deaths, or in this case, 2/3 of these deaths, are due to synthetic opioids, up to and including methadone. Prevention and recognition. Just about every overdose involving opioids is accidental. And there are many reasons for this accidental overdose emergency, but most often they are unintentional. And in fact, opioid overdose emergencies can even occur when opioids are used as directed. Those that are at the highest risk take high doses. They consume other types of sedating medications or alcohol and have a history of substance abuse, and have children, other family members, friends, loved ones who have access to unlocked or unsecured prescription opioids. And what I mean by that is this. A lot of times, some family member might see you take oxycodone, for example, and they know that it makes you feel much better. You're no longer in pain. So they decide to try it. And as a matter of fact, if you are around children in your household, children have access to the medicine cabinet, and if they do, they're more than likely to be tempted to try the medication that you have, the opioid. And more than 80% of teens that are taking opioids self-medicate. And this has been a major issue with respect to the crisis that we currently face. The bottom line is that anyone who uses opioids for pain control or for recreational purposes is at risk for an opioid emergency. How does the emergency occur? Well, I'm not going to read everything that you see here, but basically an opioid overdose emergency occurs when there's so many opioid molecules in the brain that they overwhelm the brain receptors and block the body's ability to breathe. And they slow the heart down, they block the body's ability to breathe, and they present a life-threatening event characterized by shallow breathing, slowed heartbeat, weak pulse, loss of consciousness, pale blue or cold skin. And if the person stops breathing without sufficient oxygen, the brain is going to severely suffer. And within 4 to 6 minutes, death can occur to that individual because they're no longer getting critical oxygen to the brain. Emergency treatment symptoms, they're prevented if the person receives medical care right away. Now, for the years, these treatments have quickly reversed opioid overdoses when they are taken care of right away to help restore breathing. But it's only been available to medical and hospital trained personnel. However, recently, as you know, the FDA has approved emergency treatments directly from your pharmacy, and many insurance plans cover them at a relatively low cost. The most recent provisional data from the CDC indicate that approximately 70,000 opioid deaths occur in the US within a 12-month period. So the CDC recommends the following, and I'm going to skip down to the point that is really critical here, in that individuals who are at risk for opioid overdose can be treated with a life-saving drug called Narcan or naloxone. Recently in the news, as you may well know, based on the number of opioid deaths caused by fentanyl that a number of students have suffered by and have died, the LAUSD has authorized the distribution of Narcan in every school within LAUSD. Just the day before yesterday, the LA City Council, not the LA City Council, but the LA Board of Supervisors authorized the distribution of Narcan in every library. Now, distribution of Narcan in the schools has already started to occur. The library distribution of Narcan will take place within the next couple of weeks. But in the meantime, the CDC, as well as the FDA, is encouraging the public, and that means you and me, to go out and have Narcan available at our homes so that if an opioid emergency occurs, you will be able to save a life with this particular the drug, which I'll describe and demonstrate for you later. I did some sleuthing and I found that CVS sells Narcan over the counter at approximately $79.99. Now, Narcan has been in use for more than 40 years. It is already approved by the CDC. It's already used by paramedics. LAPD officers on patrol have Narcan as a part of their kits. And Narcan will absolutely 100% control an overdose and bring the person back from that overdose scenario. It doesn't affect, Narcan does not affect any other symptom in the body other than the receptors in the brain that are blocking or keeping that person from breathing. Narcan only affects that. It has no other effect on any other part of the body. It's also available for sale at Rite Aid, which let's say with insurance, it's about $109. And as you can see, multiple doses of naloxone can be administered for a single overdose as needed. But it's not an emergency it is not a substitute for emergency medical care. Now, let me explain what I mean by that. Normally, anytime there's an emergency, the first thing people do is to call 911. Is that right? Right. Well, in the case of an opioid or a drug overdose, the first thing you do is to give that person a dose of Narcan. And I'll demonstrate this for you a little bit later. But Narcan will absolutely bring the person back to conscious level within 5 minutes, if not sooner. So once you've given the person a dose of Narcan, then you call 911. And then you check that person to see if they are breathing and perform CPR or other first aid techniques if called for. So again, in an opioid drug overdose, the first thing you do is to administer Narcan because time is critical. If the brain does not receive oxygen within 4 to 6 minutes, that person will certainly die because the brain is not getting oxygen. So Narcan is the key here. Again, what is naloxone? It's a safe medication that reverses an opioid overdose. It's been in use for a long time. It displaces the opioids from the receptor sites in the brain for about 30 to 90 minutes. This gives you time to, again, you shouldn't have called 911 by now. It gives the person time to be rescued by paramedics and to be taken to the hospital. Narcan reverses the respiratory depression and can wake someone up in just a few minutes. The key thing here to make note of, it is available without a prescription. You do not need a prescription for Narcan. You just walk up to the drug counter in CVS or Rite Aid. You tell them what you want. It is not a controlled substance, and there's no known negative side effects or reactions for Narcan use, and it does no harm to the individual. So again, Narcan is the medication that is recommended that everyone have in their medicine cabinet, over-the-counter purchase. It comes in a 2-pack. And the reason why it comes in a 2-pack is simply because that person where you've given that first dosage, when they come to, they may need a second dose because they may relapse, and that's why a second dose of Narcan may be appropriate in that case. Strategies in preventing overdose deaths. As you can see, we want to encourage everyone that are at high risk, like family members, providers, and others, to learn about how to prevent and manage an opioid overdose. And we'll talk about that in just a few moments. We want to ensure that everyone has access to treatment to reverse the effects of an opioid overdose. Everyone should know about Narcan, except kids. Again, Narcan is a type of medication because kids have a habit of self-dosing. You don't want them going into the medicine cabinet and accessing something that they shouldn't be. Obviously, in an opioid overdose, once you've given that person a Narcan, you want to make sure that 911 has been called. And you want to encourage prescribers to use prescriptions for monitoring programs for opioid overdose. What is an opioid overdose? Well, I explained earlier that the brain has many receptors for opioids, and when too many opioids occupy and take up those receptors, they block the person's ability to breathe, slowing down heart rate, pulse rate, and many receptors then actually stop the breathing of the individual. It's an ongoing situation because opioids sit on the brain receptors to decrease the ability to breathe. They slow the breathing down, the breathing stops. Because of lack of oxygen, the brain may suffer damage, the heart stops, and death occurs. And all of this can happen within 6 minutes if the treatment has not been administered to that individual. And the treatment has to be administered within 6 minutes. And then, so therefore, there's no time to waste. Signs of an overdose: unusual sleepiness or drowsiness, slowed or slurred speech, sleepy or nodding off. You can't wake that person up. They will respond to stimulation such as yelling their name, sternal rub, pinching, or shaking, however, but they will be mentally confused. In an overdose state, again, difficulty breathing, choking sounds, such as something that sounds like they are breathing, but it sounds like this. It's called agonal gasp. It is not breathing. It's a gurgling or rattling sound or snoring. The skin is pale or clammy. The fingernail or lips can turn blue, gray, purple, and they cannot be wakened with stimulation, and they're unable to speak. The breathing is very slow, irregular, or the person has stopped breathing altogether. These are signs of overdose. So as you can see here, breathing will be slow or gone. The lips and nails are blue. The person isn't moving. They may be choking. You can hear gurgling sounds. You can't wake them up. The skin feels cold and clammy, and the pupils in the eyeballs will be very tiny, like pinpoints. These are signs and symptoms of an opioid overdose. And that's where you have to jump in and give treatment. How do you respond to the overdose? You evaluate, first of all, for the signs of the overdose. You call for emergency services 911, and that's listed as number 2 because typically it takes 911 9 to 12 minutes to arrive at a location on average. It takes EMS 9 to 12 minutes to arrive, and that's depending upon traffic as well. So after you've called 911, put that in motion, you want to administer a Narcan or naloxone to support breathing. And then of course you want to monitor the individual for response. And I should say, once that Narcan has been given, the person will wake up almost right away. They will wake up within minutes after you administer that dose of Narcan. Step 1, evaluate the person and checking for response. So try to shake the person, try to call out their name. And if there's no response, perform what is called a sternal rub. That's where you take your knuckles and you grind your knuckles in their chest for about 5 to 10 seconds. Believe me, if someone did that to you, or even if you did it to yourself very hard, you will respond. If you would actually conscious, you would feel that sternal rub. So if no response to name calling, that's a play on words. If no response, then perform the sternal rub on the chest bone for 5 to 10 seconds. And if there's no response, they could be experiencing an overdose. Step 2, call for emergency services, call for help. Again, in many states, calling emergency services protects you from prosecution. But keep in mind, in rural areas, response times for emergency services may be even longer. Someone is overdosed, so you're calling 911. Someone is overdosed, you place a call, you're waiting for 911 to arrive at your location. You administer the Narcan or the naloxone. Naloxone is the ingredient that is contained in the Narcan. Narcan is the brand name. And there are 3 forms of Narcan or naloxone: intravenous, meaning injection; intramuscular, where the injection is made in the thigh or the arm or shoulder itself; and then intranasal, which is probably the most popular way to administer Narcan because it brings that person back almost right away. Narcan, keep in mind, only works for anywhere from 30 to 90 minutes. Opioids can stay longer in the body, but once the Narcan wears off, that person can come back and start to exhibit another overdose scenario. That is why that box of Narcan that I showed you earlier contains 2 Narcan injections for nasal. Multiple doses may be necessary if that person comes back, particularly if they have ingested fentanyl that's been laced in various drugs that unbeknownst to them. Again, one of the reasons why, the major reason why LAUSD has authorized Narcan to be administered in all schools is because students have been dying from a fentanyl overdose that's contained in Narcan, in a opioid substance that they've ingested. The latest situation with respect to fentanyl, you've heard on the news something that's called rainbow fentanyl. And rainbow fentanyl is a tablet, but it's multicolor. And when children see colors in tablets or in pills, they have a tendency to take them. And this is the reason, this is a major reasons why the drug cartels are manufacturing these fentanyl tablets in colors to entice more kids to take them. And again, we all know what happens when they do that. So how do you give Narcan? How do you give naloxone? The first thing you do, this is a drainer that I have here. As you can see, it has a plunger at the bottom. So you take your forefinger and your middle finger and you put it on the top of the Narcan itself. Your thumb is going to be used to press the plunger once you inserted it in the nostril of the individual. So you're laying the person flat on their back, and with the Narcan, you're going to insert it close in their nostril so that your fingers, that when you're holding it at the top, are going to rest against their nose. And so you're inserting the Narcan, you're using your thumb to inject the Narcan solution. That's it. It's as simple as that. It is not rocket science. There's no assembly that you have to do with the Narcan. It comes totally self-contained, and it contains 1 dose of naloxone for that overdosed individual. Questions? So again, once you've laid the person on their back, you want to take your other hand and support their neck. Chin up, your other hand's behind that person's neck. You're taking the Narcan and inserting it in the person's nose, and you're administering the spray. This is where CPR comes in, because you give CPR if you've been trained, or you do rescue breathing. For those of you who've been trained with CPR, again, because the person is not breathing, you may be called upon, you may have to do or perform CPR to keep that person alive until paramedics get there. And as you can see there, those of you who know CPR know that these are the steps and the techniques that you do to administer CPR, and up to and including breaths. Now, of course, if there's a family member that has suffered the overdose, and by the way, most overdoses of opioids occur at home. Most opioid overdoses occur at home. So therefore, you may not even think about hesitating to give breaths for an individual when you're performing CPR. And you continue to do that until health arrives. You want to monitor for response because, as I said, naloxone or Narcan works very quickly, and the person should respond anywhere between 2 to 5 minutes. The individual's breathing will improve. If the individual doesn't wake up after the first dose, then you administer a second dose. Multiple doses may be needed. If that person continues to wake up and exhibit signs of an overdose, you may need to exhibit several doses of Narcan. You stay with the individual until the first responders arrive. And when the person wakes up, let them know what's happened. And if you have to leave, put the individual in what's called a recovery position, where you put them on their side to prevent them from choking. Tips for the public. Talk to your doctor about alternatives. Take opioid painkillers. If you must take a painkiller, take it for the shortest length of time possible. Because again, it's a painkiller. It can become very addictive, and you need to be aware of what you're doing. Yes, Linda, you have your hand up. You want to unmute?
Yeah, James, my understanding is that currently the breaths are no longer required with CPR. So is that correct, or is it optional? Can you answer that? Now I have no sound from you.
Okay, there you go.
There we go. I think.
Yeah, can you hear me?
Yes.
Okay, yes, it is optional, and as I said, it's optional because if it is a family member or someone you know that lives in your household, then you probably will not hesitate to give rescue breaths, because you know rescue breaths help in the recovery process. But if it's someone who you do not know, then, and if you don't have a mask that you can put over that person's mouth before you blow, then you should not perform rescue breaths. But if it's someone you know, do the rescue breaths, but understand the risk. Again, going back to taking these painkillers, understand the risk and try to limit the amount of time and number of painkillers you take to the shortest length of time possible, because they are so habit forming that you aren't aware of it, and you can become addicted without even being aware of it. Don't share your medication, even with friends and family. Again, children, particularly teenagers, 80% of teenagers that suffer drug overdoses self-medicate. They self-medicate. And so don't share your medication, even with friends or family. Keep them out of range, out of reach of children. Dispose of unused drugs properly, and never keep them or save them for later. Store opioid painkillers in a locked box or a locking cabinet. Laws regarding opioids, well, we all know that. Laws supporting the distribution of Narcan and naloxone. All 50 states, including Washington, D.C., have laws supporting the distribution of naloxone. LA Unified has made naloxone or Narcan available on all of its campuses beginning this month. Doses of Narcan will also be provided to all LAUSD school police officers and be available at public libraries. This is according to the recent vote made forth by the LA Board of Supervisors just yesterday. Good Samaritan overdose laws, immunity laws apply here because they offer immunity or protection from liability to individuals who use naloxone in an overdose situation. And most states have these laws. But again, if you're from out of state or you're living out of state and viewing this, you may want to check your state laws for further guidance. But the Good Samaritan law says particularly that if you act in a medical emergency and not for money, you will definitely not be held liable, even if that person doesn't survive. So the Good Samaritan laws come into place here for administering naloxone in an overdose situation. Are there any questions from anyone about what I've said up to this point in time? I know, Ruth, you're a teacher. Are you aware of naloxone or Narcan in your school? Ruth?
Hello, yeah, I'm here.
Yeah. Are you aware of Narcan?
I teach in the elementary level, so I really hope we don't have to have it there.
I agree. I agree.
That was news to me that LAUSD was having it in all the schools, but it's the high schools and middle school. I don't know if is it also middle school or just high school?
I believe it's in middle schools as well, because these overdoses have taken place in schools where the child is as young as 14 years old. And there have been about 8 overdoses in public schools that are a result of fentanyl. And this has led the superintendent to authorize, by way of the board, LAUSD, for the distribution of Narcan in all schools and the police officers. So I imagine that it will, although Ruth, I think probably in your case, but you never know, because particularly in light of the fact that you've got this rainbow fentanyl that you see in colors, which are made deliberately to attract children. And children will sooner pop something that has a bright color than not. So it's something that you should be aware of. I'm glad you're aware of it. Did you have another question, Ruth?
Yes, I wondered, have you ever had to administer it to anyone?
No, but what I've done is all of the volunteer community patrol members out of West Valley have been trained on this. Officers at West Valley have been trained on this. And recently, I went through a scenario with the senior lead officers on Narcan. They're also trained on it, but officers in the community relations officers are not. So we went over that just recently.
Mhm.
I should also let you know that I won't be mentioning any names, but West Valley has selected a senior lead officer for Lake Balboa. But the name of that individual has yet to be announced. And so I won't say anything other than the fact to let you know that a senior lead officer for Lake Balboa has been selected. It's just subject to final approval, and then the trumpets will blare.
Yes, I heard it we had a coffee with the cops at our church last Saturday, I think, and Officer Scoggins told me that in November we would have a senior lead officer. So that's great news.
It is great news. It is great news. Speaking of, does anyone have any other questions as to what we've gone over? Okay, here comes the test. What is an opioid? Anyone?
It's a drug used to treat pain.
That's right. It's a painkiller.
And it's addictive.
And it's very addictive, and you not know about it because all your brain senses when you're taking these medications, all your brain senses is pleasure. You no longer feel the pain. You no longer feel the knee pain, the back pain, the shoulder pain, whatever pain that there is. You no longer feel it. And that's all you care about. And that's why so many Americans aren't aware of the consequences for continued usage of these opioids, or if they are aware of it, they don't care. All they feel is pleasure when they take it. So that's why this is a major reason why the CDC and the FDA is advising the public to have Narcan on hand in case of an overdose. Any other questions?
I think you've covered everything, James.
Well, let me stop sharing this and bring up one more thing. Okay. I don't see it. On Thursday, November 10th, there will be an Officer Appreciation Day held at West Valley. And we will be once again serving about 250 officers lunch beginning at around noon, 11:30 to 2 o'clock. And then we'll also be serving them dinner. Community members have already gone out and gone to various businesses to solicit donations in terms of food, drink, sodas, things of that nature. I'm still looking for people who may want to volunteer to come and help serve the officers during this time period. I sent the flyer on this event to Aaron, so hopefully he will post that on the website. I know that's what you were going to say, Linda. So,
Are you talking about me?
yes.
Oh, okay.
So, so hopefully he will place that on the website.
Well, yeah, I'm hoping that at the next Lake Balboa Neighborhood Council meeting, that you make sure to mention this so that if somebody missed it, they'll be made aware and may participate.
Absolutely, absolutely.
Thanks.
Okay. Any other questions? You know, I know last year that you, as well as Danica, helped out at the event. Danica, did you have a question? Danica, are you there?
Aha, there's the unmute button on the phone. Sorry, I'm on my iPhone. Yes, can you hear me?
Yes, I can.
It's so funny. My son Vaso literally yesterday in the truck going to practice said, Mom, when is that dinner to serve the police again? Because I want to serve the police. Can you call them and arrange it?
That's great. That is great. Well, certainly, I think he came last year, didn't he?
He did. So we're down for the dinner portion, 5 to 7 p.m.
That's great. That's great. Okay.
Now, I do have one question about the Narcan.
Yes.
What effects does it have on the body if you are not overdosed and a person
No effect.
decides to administer Narcan to themselves?
No effect.
Oh, wow. Okay.
It only affects the overdose. It only affects the receptors in the brains that have been affected by an overabundance of opioids that are keeping that person from responding, from breathing, heart rate, and so forth. And that's the only thing that it affects.
Okay, so it doesn't speed our heart rate up or anything. So that's great, because then there won't be any adverse effects from putting it out to the public.
That's right. Well, like I said, the FDA has already done that. They've already recommended that. It's in the schools now. It will be in the schools, in public libraries. And so, you know, they would not have done that if they were not sure as to what's going on with that.
Yeah, it's super scary for a mom, because you're trying to figure out how do you educate your elementary school age, because a lot of times the scare tactic or fear really doesn't work with younger children. Actually, I was at a district meeting the other day, LAUSD district meeting, and a representative, Alex, I can't remember his last name, from Public Safety and Health. He said that the fear tactic, because I right away said, well, let's have some seminars in the schools immediately. Let's start in elementary school. And he said that statistically, the fear tactic doesn't work, because when you think about it, when your parents tell you not to do something, what do you want to do? You want to do it.
Right.
Absolutely. So I think education is power here, but it's just scary that they're doing it in the rainbow colors, because every kid I know loves Skittles.
Yes. And that is the reason why these drug cartels have manufactured these pills in rainbow type colors.
Yeah, they can pick it up thinking it's a Skittle.
Thinking it's candy. So that's you know, it's a scary time right now with respect to the fentanyl, Danica, because as I said from the outset, death rates are going through the roof. They're higher now than they've been since 2017. Last year, let's see, drug overdose, 973,000. More than 130 people a day die from opioid-related drug overdoses. I could go on. but I think you get the picture.
Yeah, it's unfortunately very dear to my heart because one of my best friends, she shot herself a year ago. And that's because I did not know it, but she had been taking opioids for over 15 years. And so it had just altered her brain thinking. I kept saying to my husband, I'm like, man, she's getting a little whacked out these days. And I thought she was just smoking too much pot,
Yeah.
but no. And it literally just altered her way of thinking to the point that she checked out.
Yeah, and again, down again from as I showed, and there only a slide of that public survey that the National Safety Council conducted among adults, and they learned that more than 40% of adults were not concerned with the dangers of taking these opioids. They weren't concerned with it, and they just knew that every time they took them, they felt pleasure because they no longer felt pain. And we all know what pain feels like. My wife had back surgery, and for quite a while before she elected to do that surgery, I was waking up at 2 o'clock in the morning helping her because she was moaning and groaning, and I was waking up and trying to help her before I would go back to sleep. And so that happened before she elected to have surgery, and she was totally against taking any kind of medication.
Right.
And she had tried Oxycontin, but it had in itself side effects, as you may well know.
Uh-huh.
And so, but we have to be careful when we take these medications. There's nothing wrong with them as long as they're legally prescribed. And keep in mind this, and I just want to reiterate the fact that we're involved in a situation right now. The government's involved in a situation where they are actually going after these manufacturers of these drugs and forcing them to put warning labels on the drugs, because a lot of the drugs, which is why Purdue Pharma was sued successfully for just $6 billion, they didn't put a warning label on Oxycontin saying that it was habit forming.
I know, and they knew it the whole time. I also think that, okay, so here's the thing, James. My friend was getting this as a prescription. I found out after her death that she had bought a house. She was living here and she bought a house in Austin. She would fly here because the only doctor that would write the prescription for her was here in freaking LA. So, to me, it's like, the doctor knows.
Yeah, of course.
They know.
Again, but
they know.
Understand, see, it's all about the money. The manufacturers make the drugs. They have at the wholesale level, sales representatives go out to these doctors' offices. They wait in the waiting rooms. They wait in the waiting rooms, and they go in to see these doctors. They smile and practice gal techniques.
Mm-hmm.
They smile and gal, and they offer these doctors incentives for writing the prescription for the opioid, for the medication.
Mm-hmm.
They offer them incentives to do that. And so what do the doctors do? They just open their prescription book and they just write every time you walk in, oh, doctor, oh, here's a prescription, type of thing.
Mm-hmm.
There are two states right now which are the most opioid overdose is most prevalent. The first state is West Virginia. West Virginia is basically coal mining. West Virginia, there's high rates of unemployment. And they have the highest rate in the country of opioid overdoses. That's followed by Ohio. Those two states are pretty much close together. They still do coal because coal is still mined in West Virginia,
right,
and in Ohio. And these workers suffer back pains. They take opioids.
Right.
California ranks high up there in terms of opioid overdoses. And so, again, all the more reasons why parents have to be aware as to what their children are doing, educate their children with respect to the dangers of it if they are of age where they can understand. And also, there's a website that you can go to and get labels that you can label medications as being habit forming. And so these are just some of the things that you could do. I could put out something later on, but I think you get the gist.
Right.
Ruth, you had a question?
Yes, but Linda Schwering's been waiting a while with her hand up.
Okay, Linda, you're up, and then Ruth.
Oh, I'm first. Okay. My thought was after the discussion and what Danica mentioned, I think I might suggest that patients, when they visit their physician, sit down and talk to them and ask them how they feel about prescribing certain medications and whether or not they would have alternative suggestions to
Absolutely.
the common opioids.
Absolutely.
Because opioid painkillers are not the only answer, and sometimes physicians that are keeping up on modern times will have alternatives or suggestions for their patients that do not involve opioids. That's my
Excellent
thought.
point. Excellent point, Linda. You're absolutely right. I think everyone should do that. Is there an alternative to what you're prescribing me? Because I see that it has an opioid in it, or does it have an opioid in it? And if it does, is there an alternative? Absolutely right, Linda. You're right on, spot on. Ruth, you had your hand up.
Let's see, am I unmuted? Yes. I want to say sorry to Danica for the loss of her friend, and going back to the November 10th officer appreciation. I also helped last year, and I think I can help in the evening again. And
That's great. That's great.
I'm going to leave the meeting. So
Well,
long night.
the time is right. It's about 7:59 right now. And so if there's no other questions, I really appreciate everyone for coming to the meeting. This is a topic that I think, unfortunately, we'll hear more of as time goes on because people aren't going to stop overnight. But the more people that become educated, the better for us all. And so it's a national epidemic and we've got to be aware of it. Again, thanks everyone for coming. I really appreciate it. And with that, I declare the meeting over, done, finito. Thanks for coming. Good night, everyone.
Thanks, James. Good night.
Good night. Hey, Vasa, we're going to go feed the policemen on November